Hello, and welcome back to Cultural Geography. As I said before, I will be making video lectures to accompany the chapters in your textbook. The videos will highlight some of the key points in the chapter, but not all of them. It is your responsibility to be in charge of the material covered in the textbook, as you will be quizzed on this material as well. In this video lecture, I introduce what life expectancy is, crude birth rates, crude death rates, and total fertility rates, and what factors contribute to them, and how they vary geographically. So on that note, let's go. From your textbook, life expectancy is the average number of years an individual can be expected to live given current social, economic, and medical conditions. Because these contributing factors, one would expect that life expectancy varies by geographical area and era, which it does. For example, the life expectancy in the U.S. in 1960 was 69.77 years, and in 2014 it was 78.94. On average, we are living almost 10 years longer. For now, I want you to think about why we live longer. We'll talk more about this in the coming slides. So now let's turn our attention to how life expectancy varies geographically. So here is a graph showing life expectancy for Sweden in the green, the UK in blue, the United States in yellow, and Rwanda in red. The year is represented along the horizontal axis, while the average life expectancy is shown on the vertical axis. So let's look at Rwanda first. In 1960, the life expectancy was 42.25 years, and in 2014, it was 63.97 years. So this is approximately a 21-year increase in life expectancy over the course of 54 years. Next, you might have noticed this large gap in life expectancy between Rwanda, which is in sub-Saharan Africa, and the other three countries. So in 1960, what might explain why Rwanda has such a low life expectancy? Some of the leading causes were poor sanitation, access to health care and healthcare shortage, access to clean water, malnutrition, and disease. In contrast, Sweden, the UK, and the United States are considered to be more developed countries than Rwanda, which tend to provide their citizens with better sanitation services, access to health care, clean water, and various forms of disease prevention and treatments. Furthermore, the child mortality was even very high at 216 deaths per 1,000 newborns in Rwanda, with a significant portion of the young children dying under the age of 5. You'd expect this to influence life expectancy. Again, think about what might be the cause of this high rate of mortality for children under the age of 5. So let's turn back to the life expectancy graph. We can see there's a very large dip in life expectancy in Rwanda beginning in 1984 and continuing to about 1993. In 1984, the life expectancy was 50.78 years, and in 1993, it fell to only 27.08. Imagine only having a life expectancy of 27 years. That is a significant decline in life expectancy. So what do you think is the cause or causes of this rapid decline in life expectancy during these periods of time? Well, there are two contributing factors. Beginning in 1984, the AIDS-HIV epidemic was severe and devastating. Then beginning in 1990 and lasting through August 1993 was the Rwandan Civil War. Its estimated death toll was 800,000 Rwandese and had a devastating impact on the national health system as well. However, with advances in healthcare, sanitation, food security, and clean water, the life expectancy is climbing and is now at 63.97 as of 2014. We can see that the gap between life expectancy in Rwanda and the other three countries is beginning to close. So this map is from an article written in the New York Times titled, "The Rich Live Longer Everywhere. For the Poor, Geography Matters." So this map shows life expectancy for 40-year-olds with a household income below $28,000 per year. So areas in red have the lowest life expectancy, and the dark blue areas have the highest life expectancy. Why do you think there's such a wide variation? For example, in Boise, the life expectancy is 80.5, which is about average for the rest of the country. But in Pecos, Texas, the life expectancy is only 75.6 years. Why is it so much lower than the Boise area? And Glenwood Springs right here has the highest life expectancy at 83.4 years. So here in the United States, we can see a very large difference in life expectancy. So where you live, you can expect to live longer. So let's examine why this is. Poor in some cities, big ones like New York and Los Angeles, and also quite a few smaller ones like Birmingham, Alabama, live nearly as long as their middle-class neighbors, or have seen rising life expectancies in the 21st century. But in some other parts of the country, adults with the lowest income die on average as young as people in much poorer nations like Rwanda, and their lifespans are getting shorter. The gap in lifespans between the rich and the poor widened from 2001 to 2014. The top 1% in income among American men live 15 years longer than the poorest 1%. For women, the gap is 10 years. These rich Americans have gained 3 years of longevity just in this century. They live longer almost without regard to where they live. Poor Americans have very little gain as a whole, with big differences among different places. The fact that some places have increased in the lifespan of their poorest residents suggests that improving public health doesn't require fixing the broad, multi-decade problem of income inequality. Small-scale, local policies to help the poor adapt and maintain healthier habits may succeed in extending their lives, regardless of what happens with the trend in income inequality. It could be as simple as this: wealth buys healthier, quality medical care, which allows people to live to an old age. But a long line of evidence suggests it's less obvious than it might seem. The affluent seem to live in healthier ways. They exercise more, smoke less, feel less stressed, and are less likely to be obese. Research has long established that healthcare interventions have a much smaller effect on lifespan than behavioral factors like smoking and exercise. So, as we can see, there are many factors that are correlated with life expectancy, and in order to make improvements, many of these factors need to be addressed simultaneously. So this map shows the obesity rate of high school students in 2013. A new study contends that the rising childhood obesity rates will cut average U.S. life expectancy from birth by 2 to 5 years in the coming decades, a magnitude of decline last seen in the United States during the Great Depression. That should be an astounding and eye-opening statistic there for you. As I laid out, the factors or variables that help explain life expectancy are many, they're complicated, and they're all interconnected. So let's turn our attention now to crude birth rate. Crude birth rate is the total number of live births in a year for every 1,000 people alive in that society. So let's look at some maps and graphs on crude birth rate to help better understand this definition and what factors contribute to crude birth rate. This is a map from your textbook, and the first thing you might notice is that sub-Saharan Africa has some of the highest crude birth rates in the world, while Europe and Japan has some of the lowest rates. Why is this? So let's turn to the graph to look at this more closely. So in this graph, again, the years are on the horizontal axis and go from 1960 to 2014, and the vertical axis represents crude birth rates. So in 1960, the crude birth rate in Rwanda was 52.25. So what that means is that for every 1,000 people in Rwanda, there are 52 births that year. That's a lot of babies. Compare this to Sweden at 13.7. So every 1,000 people in Sweden, there's 13 children born. So why such a vast difference in crude birth rates? Some of the key reasons for this high birth rate in Rwanda, as with most countries in sub-Saharan Africa, is the high rate of infant mortality. If your child is more likely to die before adulthood, you are more likely to have more children in hopes that some will eventually reach adulthood. And this is a significant concern in Rwanda, but less so in Sweden, for example. Also, the importance of children as part of the labor force. So rates tend to be higher in developing countries, especially in rural areas where children begin working to help raise crops at an early age. So the average age of marriage is another factor. So earlier a woman marries, the more children she is likely to have. Also, women's rights play a role in the number of children she will have. So do you suspect women have more rights in Sweden than in Rwanda in 1960, or even today? So if a woman does not have the right to say no to marriage, to sex, to not using birth control, or the number of children she would like to have, this is going to impact the birth rate, or the crude birth rate. Educational opportunities for women and the availability of legal abortions also plays a factor in the crude birth rates. So as we can see in this graph, crude birth rates are declining for these countries, and the world trend is as well. So this is due in part to the factors that I just mentioned. The next thing let's turn our attention to is crude death rate. Crude death rate is the total number of deaths in a year for every 1,000 people alive in a society. So let's look at some maps and graphs again on this crude death rate to help understand what's going on here. So again, this is a map out of your textbook. And again, you'll notice sub-Saharan Africa has some of the highest crude death rates in the world. But so does Russia. Why? Well, I think we should explain some of the reasons why the death rates might be so high in sub-Saharan Africa in terms of health care, access to clean water, and so forth. But let's take a look at what's going on in Russia. So this is a graph. The years are on the horizontal axis again, from 1960 to 2014, and the vertical axis represents crude death rate. So we discussed why the crude death rate was so high in Rwanda in 1984 to 1994, but we also noticed that the crude death rate is 7.5 deaths per 1,000, which is less than the world crude death rate and the other countries on the graph. What causes this significant reversal in crude death rates? I'll let you think about that. Let's turn now to Russia. The crude death rate is significantly higher than the other countries, including the world's crude death rate. Why is this? Some of the factors that contribute to this are the high rates of alcoholism and smoking. Alcohol consumption has been linked to the largest share of deaths for those aged 15 to 54 in Russia, as much as half, according to this one study. Tobacco use also contributes substantially to premature deaths, with the result of smoking and alcohol use combined account for an estimated 1 million Russian deaths a year. So the takeaway here is that while there are many similar reasons that help explain crude death rate, it can also have very different reasons depending on where you are in the world. There's probably not a lot of people dying in Rwanda from alcoholism and smoking-related problems at any point in history for Rwanda. So the next thing I want to talk about here is total fertility rate. And total fertility rate is the average number of children a woman will have through her childbearing years, and those childbearing years are roughly ages 15 to 49. So the next definition here is the replacement level fertility, is the level of fertility at which a population exactly replaces itself from generation to generation. So there's not going to be any population growth, it's going to be completely stable. So in developing countries, this replacement level fertility can be taken at an average of 2.1 children per woman. In countries with high infant mortality rates, however, this average number of births may need to be much higher to counterbalance this. It might be 3.2 or somewhere in there, but it's going to have to be higher than it is for more developed countries like the United States and Europe at 2.1. So let's look at some maps and graphs on total fertility rate to help better understand this definition and what factors contribute to this. Again, another map from your book, and we'll notice that sub-Saharan Africa has some of the highest total fertility rates. Why is that? I think we've done a job of kind of explaining that in the previous slides. Many of the same factors that are associated with crude death rate also affect total fertility rate. For example, high infant mortality and the need for labor are important factors in sub-Saharan Africa. So let's turn to a graph and look at this more closely. In this graph, the years again on the horizontal axis from 1960 to 2014, and the vertical axis represents total fertility rates. First, I want to highlight that the world trend in total fertility rate is declining, and the world trend is that in purple, and we notice that it's going down and down and down. On the surface, it sounds wonderful that the total fertility rate is so low, since according to some, the world is overpopulated and putting significant pressure on our resources. However, as we will see in the coming lecture on population pyramids, this is causing and will continue to cause significant problems for countries with a low total fertility rate and a lack of migration in the coming decades. But the general understanding here that we should get from this slide is that fertility rates for the world, in these countries as well, is on a decline. So in the US, a total fertility rate of 2.1 children per woman is considered the replacement level for the population, resulting in a relatively stable in terms of the total numbers. This does not factor in migration. So if you have rates above 2.1 children, indicate the population is growing in size. And if you have it less than 2.1, then the population is going to be decreasing, and this does not factor in migration. Higher rates may also indicate difficulties for families in some situations to feed and educate their children, and women for entering the workforce. So looking at the US, one would guess that the total fertility rate would vary across the state, and you would be correct by looking at this graph. So here's a table showing total fertility rates by state. Interesting, Utah has the highest total fertility rate of the 50 states, not including the US territories. This is most likely due to religious cultural beliefs and family. Rhode Island ranks 50th at 1.63 of fertility rate, so they're below the replacement level. While I'm not certain of the specific aspects for Rhode Island's lower total fertility rate, I would suspect it has to do with women prioritizing education and careers ahead of having children. Therefore, when they do have children, it's later in life, so they have less opportunity to have multiple children. Or another factor could be the cost of living is high, therefore people can afford fewer children. So culture plays a significant role in explaining the total fertility rates. So for the United States, in 2015, it's estimated that the total fertility rate is 1.87. The US is below the replacement level of 2.1. And remember, the replacement level of 2.1 means the population is stable, it's not growing. For every death, there's a birth. So if there are fewer births than there are deaths, why is the population increasing? Migration. But for that is for another later conversation.